Now, while the jury is still out on whether the Western Cape is riding the second coronavirus wave in certain areas, health authorities have red flagged the garden route. They say while systems are in place to deal with a rapid increase, health authorities will be heading to George and surrounding areas to assess their readiness. Ayesha Ismail has those details.
Western Cape health authorities say their surveillance systems allow them to zoom in on new infections and deal with them immediately. They are able to pinpoint spikes in infections, which they've done in the past few weeks. The cluster outbreak in the southern suburbs following a super spreader event was one of them. They've also picked up a spike in cases in the garden route. Over 170 cases were recorded over the past 2 weeks.
A sharp increase of cases in George with clustering in Thembalethu and surrounding areas. So that flagged and triggered a response. So you would have seen the cases in George was running at about 10 cases, 10 cases, 10 cases, and all of a sudden in the last 3 weeks, there was a big increase in cases in that area. And it's linked to Thembalethu, to Pakhalsdorp and the Conville suburbs. We now have a facility. When we just see the increase of cases, we can actually break it down to suburbs.
In rural areas, Kluti says it was as if they had their own different peak.
Originally in March, there were a few cases that were imported because of the George airport as well. People got from international travel into George. But that was contained in George.
He says the garden route peaked later than others. Kluti believes new infections are as a result of people not adhering to safety and prevention protocols. Ayesha Ismail, Cape Town.